All right, so we're going to look at the integumentary system with its diseases and disorders. But remember, we're going to dive into a little bit of a review of the anatomy and physiology first. So with the skin, guys, remember it is the largest organ of your body, followed by the liver. Your skin does help with your immune system because it is your first line of defensive protection against things invading your body. It also provides you a sense of touch, heat, cold, and pain. The skin helps stabilize your temperature, your fluid levels, and your electrolyte balance. Remember that the skin does have 3 layers to it. Really, it's kind of 2, but subcutaneous is right below the skin. But you have the epidermis, which is the outermost layer of the skin, and then the dermis, which is the thicker layer, and then the subcutaneous is underneath the dermis. Now remember that the epidermis does consist of 5 layers as well. The cells of the layers are kind of stratified squamous. Remember, stratified means they're in layers. Squamous means they are flat or squished cells, and this is a type of epithelial tissue. Most of the cells located in the epidermis layer are what we would call keratinocytes. And then there are some melanocytes as well. Melanocytes are the ones responsible for producing melanin, which help with your skin tone. So guys, if you take a look here, you can see the layers. The epidermis is the outermost layer. Then you have the dermis. Now guys, the dermis is a form of connective tissue. So the epidermis is epithelial tissue. The dermis is connective tissue. And then you have the subcutaneous or kind of fatty layer underneath, which sometimes is also called the hypodermis. Now with the dermis being that deeper layer, it does consist of lots of types of connective tissue, and there are a variety of different cell shapes as well as different types of connective tissue with their matrix. Blood vessels and nerves are found in this layer. The subcutaneous layer is deeper than the dermis, and it's mostly going to be composed of that adipose tissue or fat cells. And then there's also blood vessels. We see that embedded in the dermis and extending up through the epidermis are sebaceous, apocrine, and eccrine sweat glands. Sebaceous glands are going to produce oil, or what we call sebum. The apocrine glands are located in areas like your axilla area, your underarms, the breasts, the umbilicus area, the anus, and the genital area. The eccrine glands are found throughout the body and help regulate heat. Now, the apocrine and the eccrine glands are the sweat glands. Hair follicles in the dermal layer are going to extend up through the epidermis. Now, there are some common signs and symptoms when we are talking about integumentary issues. We can see that we have skin lesions, and there are a lot of different types of skin lesions. I have a picture here to kind of show you that these are mostly going to be some sort of like abnormal or discontinued area in the skin that looks different. So we could have a lesion like a papilla. This happens sometimes with like a mosquito bite, but it's a solid kind of elevated area. We also have something called like the plaque. These are more scaly. We have macula. Maculas are like freckles. We also have patches, and these are just going to be larger, and sometimes these are also known as moles, specifically if they deal with having concentrations of melanin. We also see that there could be scales, a crust, a wheal, and a wheal, guys, is elevated and it has fluid underneath, so a lot of times a wheal would also be known as a blister. We can have a cyst. It's also fluid filled but larger. A pustula, which has pus in it. A vesicle, which is a little bit bigger type of blister than what you see with a wheal. A bulla, which is even larger. An ulcer, where we see layers of the skin eroding away. And then you can even have kind of like a fissure, which is like a split in the skin. Now, this isn't all the different types of lesions, but these are just some examples. We also see patients may deal with pain, pruritus, which is itchiness. We also see edema, erythema or redness, and inflammation. Some diagnostic tests that are used a lot of times with the integumentary system are going to be biopsies, especially when we're looking at a piece of skin that looks a lot different. We might biopsy to look at what is happening, maybe a type of cancer. We might look at culture and sensitivity testing because bacterial infections are a big deal. Remember, your skin is an area that helps with a line of defense. Blood tests and even microscopic smear examinations may be utilized. This is really important with the smears when we're looking at like fungus or other parasitic type of infections. All right, so we are going to look at different types of diseases and kind of put them in categories. And so we're going to look at infectious diseases that are viral first, that deal with the skin. The first one we see here is herpes. Herpes is a large family of viruses that's out there. And when we look at this, we do see the symptoms are relatively the same based on what kind of herpes is present. We do see inflammation of the skin, and then a lot of times there's clusters or fluid-filled vesicles that are present. They are normally very itchy and sometimes painful in some cases. We do see that these types of infections, because they are viral, may become more of an issue, and we would call that an exacerbation. And then they may also go away in a kind of a remission type of state. Since it's a virus, there's no cure for these, so they remain inside the affected individual's body for life. There are several different types, and we're going to talk about them. So the first herpes, or the most common ones that we'd see, is herpes simplex 1. These are known as fever blisters or cold sores, and they tend to normally happen around the mouth. However, they can be located in other areas. We also have herpes simplex 2, which is also known as herpes genitalis or genital herpes. Herpes varicella, which is chickenpox. And then herpes zoster, which is what causes shingles. Now, there is a vaccine available for herpes varicella, for chickenpox. A lot of people nowadays don't even have to get chickenpox. And then for herpes zosters, for shingles, we see that there is a vaccine, but it's normally for patients who are over 60. The next one we want to see viral infection wise is what we call verrucae or verruca. This is also known as warts. This is a chronic condition as well, because again, viral infections, they're not going to necessarily be completely eradicated from your body. They can occur in multiples and in different sizes, shapes, and even appearances based on where they're located. A lot of times these warts are often resistant to treatments. Now, there's a lot of different types of treatments out there that they might utilize. Some will talk about how they'll freeze off warts, others will burn them off, but you got to get the really kind of deep-seated part in order to take care of it, but the virus is still present. There are different types. If they appear on your hands and your fingers in children, those are a lot of times are called common warts. Appearance on the soles of your feet are known as plantar warts. And if you get sexually transmitted type of warts as genital warts. Now again, the treatment obviously is going to depend mostly on the location. Another type of viral infection that affects the skin is measles. Measles is a highly contagious disease, and it's known as a childhood disease. And so because of this, it's going to be discussed in more detail in chapter 20 in Patho 2, but we do see that it is going to be a maculopapular type of skin rash that happens on the skin, and that's what indicates that measles is kind of happening inside of the body. Now let's switch gears a little bit and look at the infectious diseases that are going to be in the bacterial group. We see the first one here is impetigo. Impetigo is also highly contagious skin disorder. It affects the face and hands most of the time in children. And so it gets on their hands, they touch their face, and it spreads. The main kind of cause of this is either going to be a streptococcus bacteria or a staphylococcus bacteria. Symptoms include vesicles, okay, so these raised areas. Pustules may rupture, and when they rupture, they produce kind of like a yellow crust over the lesion. If you were to get that, there are some bacteria that would be present. If you spread it around, that's how it can spread very easily from one person to the next, or even do self-contamination from one area on the body to somewhere else. The main treatments are keeping things clean, and because it's bacterial, could use antibiotic ointments on the skin. Another type of bacterial type of infection is folliculitis. Folliculitis is inflammation and infection of an actual hair follicle. This is caused by the bacteria in the Staphylococcus group. Symptoms here are going to be small pustules that surround the hair follicle. Treatment would be antibiotic cream or oral medications depending on how severe the problem is. We also see that there could be a progression that happens when we look at folliculitis. They can actually get a lot larger. These could be abscesses, furnicles, or carbuncles. These are encapsulated lesions with inflammation and infection. So an abscess is located collection of pus, but it can happen in any tissue, not just the skin. A furnicle is an abscess occurring in the skin, and it's commonly called a boil. So carbuncles are kind of larger abscesses or interconnected furnicles. These are going to be normally less common. Now, the cause for these are also Staphylococcus bacteria. You're more prone to these if you have a lowered immune system and also poor personal hygiene. Symptoms are extreme pain in the area due to the swelling and the infection present. Treatment are warm compresses that helps draw the pus to the surface. We may need to open them and surgically drain them if they get too large. And antibacterial medications like antibiotics may need to be used. Another type of bacterial infection is cellulitis. Cellulitis is a diffuse or spreading inflammation of the skin and subcutaneous tissue. So this is where it's going to go deeper and it starts to spread over an area. The common causes are bacteria that's in the group Streptococcus or Staphylococcus. Symptoms are pain, redness, swelling, warmth, tenderness if the involved skin. And so if you'll look here, a lot of these are what we see with just basic inflammation anyways, but we do see that it starts to get a lot more tender as it spreads across the skin. Treatment is oral antibiotics, and we can help prevent cellulitis by using good hand washing techniques as a patient, but also as a healthcare provider, and then cleansing any open areas on the skin very carefully. Okay? Cleansing them so that hopefully things don't get in, because a lot of times when we talk about Streptococcus and Staphylococcus, they are what we call opportunistic bacteria. They're on your skin right now, but if there's a break in the skin and they can get into the skin, under the skin, that's where they can cause their infection. We have erythrosyphilis. This is an acute infection of the dermis and it extends down into the fat tissue. This happens mostly in children or older individuals. There's not really much of an infection in the ages in between. But we do see that the most common cause is a group A Streptococcus bacteria. Symptoms include fatigue, chills, fever, headaches, and vomiting. The infected skin consistency is similar to that of an orange peel. So the skin starts to feel different as well due to the infection that's present. Treatment is oral or IV antibiotics depending on how severe the infection is. Another one is Lyme disease. Lyme disease is a multi-system infection transmitted to humans through the bite of an infected deer tick. So this comes from a tick, but it is a type of bacterial infection. Symptoms include flu-like symptoms, arthritis will occur, malaise where they just don't feel good, chills, fever. But one of the most common things that we see with Lyme disease is this bullseye type skin rash that happens. Treatment again is antibiotics, and guys, preventative measures of this is to help protect yourself from potential tick bites. Especially deer ticks, they're going to be found more in like the forest, and so if you're going to go hiking and things like that, make sure that you wear the proper type of attire and also check yourself for ticks afterwards. Another one is the methicillin-resistant Staphylococcus aureus. This is also known as MRSA or MRSA. This is a strand of bacteria that is resistant to the antibiotics that we commonly use for staphylococcal infections. This is what happens, guys, when we overuse antibiotics and we also do not finish them as patients. Both healthcare and community acquired type of MRSA infections do occur. Symptoms are small red bumps. They resemble pimples or even small boils. They will progress to abscesses. This will progress into a blood-borne infection, which can cause the patient to be septic. Symptoms of a patient having sepsis or being septic would be rash, fever, chills, headache. They'll start to have joint pain, shortness of breath. Now, this can be life-threatening and it requires immediate medical attention. The hard part is this is going to be resistant to most of the types of antibiotics that we have. So we need to culture it and check its sensitivity. We need to use that sensitivity test to see what antibiotic it's sensitive to and at what level. We need to carefully cleanse and wash the area with antibacterial soap, give oral antibiotics, and a lot of times we have to give intravenous vancomycin. That is a specific type of antibiotic that normally this guy is not immune to. But even though vancomycin is currently affected, we do see signs of this mutating and building up a resistance against it as well. So we have to be very careful about the antibiotics we use and the dosages we use. Fungal infections like Tinea or fungal infections known as ringworm, they tend to infect warm, moist areas of your body. They like to feed on that sweat, that perspiration that we have, and also dead skin cells. There are different types and they get named based on their location. So we have Tinea corpios. This is going to affect smooth skin on the arms, legs, and body, the body itself. The Tinea pedis is going to be like athlete's foot. Tinea cruaris is jock itch. Tinea unguium is going to affect the fingernails and the toenails like you see here. Tinea capitis affects the scalp. And then Tinea barbae affects the bearded areas. So what are the symptoms? These are going to be itchiness, cracking of the skin, and weeping of the skin due to those cracks because of the fluid. Diagnosis is going to be done by taking a kind of skin scraping and looking at it underneath the microscope and seeing that it is a fungus. Treatment, we need to keep the affected area clean and dry. Antifungal medication might be used. These might be like creams. They may also be an oral type of medication and used consistently for a long period of time. Fungal infections are very hard to get rid of, especially if they start to get deep-seated, like underneath of the toenails. These infections commonly reoccur and they become chronic problems. Candidiasis is another type of fungal infection. This is commonly called a yeast infection. It can be superficial, okay, just on like the surface of the skin or a mucous membrane, but it could become systemic. And if it gets systemic, it can also become life-threatening. This is going to be caused by Candida. It's a type of fungus, and it is going to have antibiotic therapy that disrupts your normal flora, cause it to flourish. A lot of times the bacteria on your skin, which is your normal flora, keeps this type of fungus at bay. It keeps it from gaining control or a stronghold. But when you take antibiotics because you have a different infection, your normal flora also suffers and it dies. And this gives this type of yeast, this type of fungus, a chance to flourish and cause you to get sick. Symptoms are going to be depending on the location. If it's in the mouth, we call this thrush, and there's patches of white infection present. If it happens on a baby's bottom, we call this diaper rash. It causes an inflamed, scaly rash on their bottom. If it's going to take place in your fingernails, we would call this onychomycosis. This is going to have itchy skin around the area with blisters and pustules. If it's in the vagina, it's going to be vaginitis. This causes a white, cheesy vaginal discharge, and it's talked about more in chapter 17. Treatments are antifungal medications. Now guys, one thing, if the fungus gets in the fingernails, if you were to scratch anything, it can spread to other parts of the skin very easily. Another group of infectious diseases are parasitic. Parasitic diseases are going to be things like bugs or worms. One that does take place on the skin is pediculosis. This is an infestation of lice. So this would be a lice infection. There are different types of lice. They get named based on the location where the hair is that they prefer. Some are head lice, body lice, or even pubic lice. Symptoms are severe itching. The main treatment is we need to eradicate them, and this is difficult because if any are left behind, there's a good chance that they'll reinfest the hair. Bathing and shampooing with medicated shampoo is really important. One example of this type of shampoo is Quell. We do see dry cleaning or washing all clothes is also super important because they can kind of embed in those and survive for short periods of time. And we need to clean and treat any furniture that may have a chance of being infested. Another type of parasitic infection on the skin is scabies or scabies. This is going to be an infestation of mites, or also known as kind of like bed bugs. They're really tiny parasites. These are going to cause intense itching as well. And a lot of times what they do is they burrow into the skin and they create these kind of elevated grayish lines as they go through the skin. Treatment here is going to be very similar to what we see with lice by using like a lindane cream like Quell, but instead of just treating the hair that the lice would be present in, these guys, because they're on the skin, you have to treat the entire body. All right, now we want to look at some of the metabolic diseases. So these aren't infectious, these are metabolic. So one that we see here is acne vulgaris. This is an inflammation of sebaceous glands or hair follicles. The cause is normally metabolic and it occurs at puberty. When we see that these types of glands start to become more prominent. They start to turn on and work more. And we have oily type of skin as well as more sweat. We also see that the symptoms here are going to be comedones and blackheads. So these are like raised type of lesions on the face and other parts of the body as well. Treatment is to cleanse the area very well. You can use over-the-counter type of treatments like Clearasil, Neutrogena, that kind of stuff. In severe cases, though, antibiotics may need to be given or steroids, or we may see a medication that has a retin A type of molecule in it to help with treating this type of acne. We also have what we call seborrheic dermatitis. This is a common type of dermatitis that affects the sebaceous glands. It's also known as cradle cap when it takes place on infants or in infants, and it's known as dandruff when it affects the scalp in children and adults. Symptoms are reddened skin, greasy looking yellowish scales, and treatment is medicated shampoos or even steroid lotions or creams. Sebaceous cysts, these are a closed sac of oily, cheese-like material that collects underneath the skin. These commonly develop on the scalp, neck, or groin region. We see that there's a special type called the pilonidal cyst. This is found right at the very top of the butt crack in a sense. Okay, it's going to be right there where that merges. That's going to be an area that is a special type of sebaceous cyst. The cause of this is when a sebaceous gland becomes blocked and the sebum collects under the skin instead of going on top of the skin. An incision and draining it is the main type of treatment, as well as surgical removal in some cases where we need to take out that whole sebaceous gland. A lot of times this leaves a kind of crater, and we see wound care is important here with packing the area and letting it make sure it heals from the inside out. Another thing we want to look at are hypersensitivities or immune diseases that affect the skin. One example here is eczema. This is an inflammation of skin. It's not really dangerous. It's also not contagious. You can't spread eczema from one person to the next, but it's also not curable. The cause occurs in individuals with a genetic predisposition to allergies. Okay, if an individual has a predisposition to lots of allergies, a lot of times we see eczema may occur on their skin. The symptoms of eczema are dry, leathery skin lesions. They are going to be itchy. They will appear red. They might start to develop vesicles and pustules, especially if they are scratched a lot. Okay, because that whole idea of scratching them when you are using your fingernails, they can embed other things and cause them to get infected. This could also lead to scales and even crusting to occur. Treatment is topical cortisone creams, a type of steroid cream. We may also use antihistamines, sedatives, and that's to make sure that they don't itch, especially when it's in kids, and then avoidance of sunlight because sunlight tends to make eczema worse. The next one we see is urticaria. This is a vascular reaction of the skin, also known as hives or a needle rash. The cause here are irritants such as insect bites, pollen, or plants. It could also be like drug related with antibiotics. Symptoms are severe itching when these rashes occur, and treatment is antihistamines and avoiding the allergen that triggered the hives. Okay, so figuring out what triggered them could be very beneficial to help prevent it from happening again. Another type of hypersensitivity is called contact dermatitis. This can be acute or chronic type of allergic reaction that happens on the skin. Common causes are going to be by cosmetics, laundry products, jewelry. It could be lotions or soaps, anything that potentially comes in contact with the skin that could irritate it if you have a sensitivity. Symptoms are pain. We might see small red or localized lesions or vascular lesions start to occur. An example is like what happens when somebody gets into poison ivy. Treatment is topical medications, antihistamines to help relieve the itch are important to help prevent secondary infections. We also have scleroderma here. This is an autoimmune reaction. It's a hardening and thickening of the skin, which causes a shrinking of the connective tissue to happen. This shrinking of the connective tissue doesn't just affect the skin, it affects other parts of the body. And more information can be found about scleroderma in chapter 5. All right, so now let's talk a little bit about idiopathic diseases. Idiopathic diseases are diseases that have no known cause. Okay, there tend to be a kind of familial type of history of these diseases, but we do not understand what the actual cause is. So the first one here is psoriasis. It is very common. It is a chronic skin disease. It tends to affect individuals from the age range of 15 to 35. With psoriasis, we do see times where the patient has remissions, where there's not a lot of problems with it, and other times there's huge exacerbations. Since this is idiopathic, the cause is unknown, but again, we do feel there is a hereditary basis. Symptoms are rapid replacement of epidural cells. Now, the problem here is not that they're rapidly replacing the cells, it's that the old cells are not sloughing off at the same rate. And so because of this, that epidermal layer gets thicker. This causes red raised lesions with distinct borders, and then it starts to form these silvery scales that you see here. These scales generally appear on the elbows, knees, and the scalp. Now, remember, one thing with this is it is not contagious. Psoriasis is not contagious. You cannot give it to anybody. Okay, it doesn't look very pretty, but you're not going to give it to anybody if you have psoriasis. So treatment, medications, most of these medications are things to help control the itching, like creams like containing coal tar, which there's newer treatments out there as well, but coal tar smells really bad and it's also very thick. We also see removing the scales. We can do this with salinic acid. UV light treatments tend to help individuals, but there is kind of this Goldilocks effect with UV light when we talk about psoriasis. And I call it Goldilocks because if you get too much sunlight, it can make it worse. If you don't get enough, it can also make it worse. There's a just right area for each patient that helps. Steroids can also help, and oatmeal baths help loosen up the scales. Get that outer layer of skin to start to slough off. Now, there are things that can help potentially prevent flare-ups of this from happening. A lot of times avoiding cold, or also decreasing stress, stop smoking, and also prevent from scratching your skin, because anytime you do that as well, it opens that up for potentially causing that area to repair, and that repairing could cause it to overgrow, like we see with psoriasis. Next one we see here is rosacea. Rosacea is also a chronic skin condition. It's characterized by inflammation and redness that happens mostly on your forehead, nose, cheeks, and chin. It is not dangerous or life-threatening. The cause, again, though, is unknown, and it makes it where the patient, a lot of times, even if it's not causing an issue right now, they'll blush very easily. We see fair-skinned females tend to be the higher cases of individuals with rosacea. It affects patients normally between the ages of 30 and 50. Enlargement of the blood vessels just under the skin could potentially be the main cause. Symptoms are facial skin appears red with swelling. The skin erupts similar to what we saw with acne vulgaris. We see that they will develop a very red and bulbous nose that also starts to get real ruddy looking. It becomes very uneven. Okay, we also see spider-like vessels. These are called telangiectasia. We also see bloodshot, irritated, watery eyes may be present. Now, treatment. Since there is not a known cause, there's really no way to cure it. So we need to see what triggers it to become worse, and we would want to try to avoid that. Avoid sun exposure, prolonged exertion in hot weather. That tends to make it worse. Avoid stress, spicy food, alcohol, or even hot beverages. And antibiotic ointments could be used to help control skin eruptions and help prevent infections. All right, so now let's talk about benign tumors. When we look at tumors, we see that there could be what we call seborrheic keratosis. This is a benign overgrowth of epithelial cells. This is one of the most common benign growths in older adults. The cause is unknown, but it does appear to be age-related, as we see with being a problem with older adults. Symptoms are a tan or brown growth that happens on the hands, arms, and face. It has kind of like a warty or scaly type of appearance to it, like you can see here. And the main way of treatment is to cut it out by scraping it off out. And a lot of times they want to test these too to make sure they are benign and they're not actually cancerous. Another one is a keloid. A keloid is a raised, firm, irregular shaped scar that happens when we see scar tissue develop. It happens normally after a trauma or surgery, and the cause is an overgrowth of collagen during the connective tissue repair of that scar. It's more common though in the Black population, but it can happen to anyone, and it just means instead of it being kind of a thin type of scar, it's just more raised and larger. Sometimes they can become a problem, and so surgical removal is usually not effective though, because it could result in another keloid, and that keloid could even be larger. So we do see that radiation, steroids, and maybe even chirotherapy, which is using colds, might be helpful in reducing the size of the keloid. The last benign one we see are hemangiomas. Hemangiomas are congenital benign tumors of small blood vessels that form kind of a purplish or red birthmark. These appear on the face and neck. The cause is unknown, and there are some different types. We do see that there are what we call port wine stains. This looks like wine has been spilled on the skin, like you see in this top picture. We also see that you could have a strawberry hemangioma. This is shown in the middle picture. It's a little bit more concentrated or in a particular area compared to the port wine stain. And then you can have a cherry hemangioma, which is a little bit smaller even still. Treatment is usually not necessary because a lot of them tend to disappear by the time the child is 5 years of age. But if they are in an area like around the eye or the nose or mouth where they potentially could cause issues in the development, surgical removal might need to be done. All right, so now let's look at the premalignant and malignant tumors. So these are precancerous and cancerous tumors. We have actinic keratosis. This is a premalignant condition. This is going to be very common in fair-skinned individuals, and the cause is due to excessive exposure to the sun without protection. So this is the big thing of why there's a big push of wearing sunscreen. Symptoms are wart-like lesions on the sun-exposed areas of the skin. Treatment is topical medication like the Retin A. We also could do the cartridge where we take out the pieces that are real scaly, and also chirotherapy might be useful. Basal cell carcinoma is the most common type of skin cancer. Most oftenly it affects, again, fair-skinned individuals. Those that are blonde, blue-eyed tend to have the higher risk because of the lack of melanin that's present. This is a slow-growing type of cancer, and it is going to be normally local. It's only going to really locally invade. It doesn't metastasize to far-away places in the body. The cause is unknown. It could result in genetic and environmental factors such as sun exposure as well. Symptoms and appearance varies. Sometimes they can appear very smooth. They might be a shiny type of bump, pink to pearly white in color. So there's a lot of different appearances that it can have. Treatment though is surgical removal, and in this case a lot of times they will take off layer by layer and until they get to a clean layer of tissue. Another one is squamous cell carcinoma. This one is less common than basal cell. It tends to grow though more rapidly, and it can metastasize, meaning it can spread to areas far away from where it originated. The cause tends to occur in sun-exposed areas. Symptoms: it's a firm reddish nodule that forms crust and becomes a elevated type plaque. Treatment is wide surgical excision. So in this case, they're going to take out an area around it to help prevent any of the cells being left behind, so that way it won't metastasize. And a lot of times it's followed up with radiation. The last type of cancer here that we want to kind of talk about when we talk a lot of times about skin cancer with the sun is malignant melanoma. Malignant melanoma is the most serious. It's the most life-threatening type of skin cancer here. It is responsible for the majority of skin cancer deaths. It rarely occurs before the age of 20. It may be related to severe sunburns, though, as a child. You might not have very many sunburns as a teenager or an adult, but if you had severe sunburns as a child, it could trigger this. Symptoms are where you see a change in size and color of a mole, and so this is why it's really important that you pay attention to those. Treatment depends on the degree of spread. We may need to do a wide surgical excision. Radiation may even have to happen, and if it has metastasized, we see that chemotherapy would have to occur. Another one is called Kaposi sarcoma. Kaposi sarcoma is a malignant vascular skin tumor. This means it's going to deal mostly with the blood vessels. It's not highly malignant except for in the cases of a patient who has HIV avert AIDS, really. Okay, it's not a problem when they just have HIV, it's when it actually turns into AIDS. Symptoms are bluish red patches that grow underneath the skin. And treatment is if we can treat the AIDS and help keep it in control as much as possible. Liquid nitrogen can be used to help burn them off, radiation, and chemotherapy. All right, so now let's talk a little bit about some abnormally pigmented lesions that can take place on the skin. So aphilis are freckles. These are going to indicate skin damage due to a sunburn as they start to develop. Now, these are abnormal. These are not the freckles you were really born with. This is when you get more and more of them. Lentigo, which are known as liver spots, these occur on your face, neck, and the back of the hands in older adults. A lot of times they also get termed as age spots. And then we have nevus. A nevus means mole, and it can be black, brown, or pink colored due to the collection of melanocytes in that area. And these are the ones you need to really watch to see if they develop into that melanoma type of cancer. Another type of pigment that's abnormal is albinism. This is an inheritable disease, meaning you get it from your parents. It is a decrease or the total absence of a pigment in skin, hair, and eyes. Okay, so they'll have no pigment whatsoever in their skin. Their hair will normally be very white, and their eyes may be very, very light blue to even maybe red appearance because of no pigment being present. The red is due to the blood vessels that are being reflected off the retina. Another type of pigment issue is vitiligo. This is destruction of the melanocytes in a small or large patch of skin. There could be an autoimmune issue with this when we talk about vitiligo. You can see some of the examples over here. With vitiligo, there are some famous people who had vitiligo. Joe Rogan has it, as well as Michael Jackson. He had vitiligo. One of the main treatments for vitiligo could be that you kill the rest of your melanocytes. And that's what Michael Jackson chose to do. He had the money to do it. And so because of that, that's why his skin went from being dark to very light quickly, because he had this vitiligo and the treatment was to remove it. You don't have to treat it though. It's not really a problem. You just have to be careful in those areas where there's no protection with the sun. Melasma is the next one. This is dark patches of skin on the face, especially on the cheeks. It's common in pregnant females and those taking birth control pills. It usually disappears after delivery or a discontinuation of the medication of those birth control pills. All right, so let's switch gears a little bit and talk about some diseases of the nails. This can be a disease, can cause abnormal shape, thickness, or color of the nails. Causes the most common are fungal infections, sometimes bacterial infections. Bacterial infections of the skin around the nail are known as parenchymal or parenchyma. Fungal infections frequently affect the feet. They can be very chronic and cause nail deformity, where the nails get very thick, have kind of a yellowish brown type color. Treatment: if it's a bacterial infection, we want to treat it with antibiotics, but if it's fungal, we want to treat with antifungals. All right, diseases of the hair. Hair color, texture, and distribution are genetically determined. So if you don't have enough hair, you can blame your genetics. But hair is also influenced by your hormones. So let's take a look at some of these issues. Hirsutism is excessive growth of the hair. In the female, this might be caused by a hormone imbalance or abnormality. Alopecia is a partial or complete hair loss that takes place. We also say that there can be male patterned baldness. This is the common cause of hair loss in men, and it is an inherited trait passed to males by their mothers. It can be seen in a mother's brothers, and so if you see your maternal uncle has a receding hairline and loss of hair, there's a good chance you might also have that. Symptoms: this is going to begin around the age of 30 with receding front hairline that takes place first, and we see treatment can be growth, can be restored by certain special medications, or you could use a wig, toupee, or even a hair transplant. All right, switching gears again, let's talk about some trauma that can happen to the skin. The first group we want to talk about are called mechanical traumas. These are going to be things like abrasions. Abrasions are scraping away the skin surface. This is friction, or like what we call a rug burn or a carpet burn would be an abrasion. Blunt trauma is when an individual is struck by an item such as a hammer. Something's thrown against the object, or it has fallen on you. Often causes a large bruise type area that we call a contusion. So you can see here somebody might have hit their finger with the hammer there. Another one is an avulsion. An avulsion is where a portion of skin is pulled away or torn away. Usually occurs when tissue is caught in a type of machinery. So you can see here that the finger was kind of almost degloved in a sense. This would be an avulsion where the skin was pulled off that finger. We can also see crush trauma that can take place, tissue caught between two hard surfaces. This usually involves your fingers. When you smash your fingers, your hand, your feet, or your toes. They can be caught indoors or between objects. A puncture injury is when a sharp object is forced into your tissue. This could be done by a knife, nail, glass, or metal. And so this can actually cause you to potentially develop tetanus, so we got to be careful of that. And then there's also a laceration. This is a cut in the skin caused by a sharp object like a knife, razor, or glass. So a puncture is when it goes all the way through. A laceration is when it cuts across the surface. There are some other types of trauma like thermal trauma. Thermal trauma or skin injury is due to excessive heat or cold. Injury can range from mild to severe, which then could mean it could be life-threatening if it's a severe type of thermal injury. Hyperthermia is when the body gets overheated due to excessive exposure to sun or heat. Types would be things like heat exhaustion or heat stroke. Heat exhaustion commonly occurs with excessive exercises when it's done in a very warm environment. Symptoms include profuse perspiration, loss of salt and water leads you to be dehydrated. The skin starts to get cool and moist. Weakness and nausea happens, muscle cramps, body temperature is normal. So this is the issue, is your body is taking care of it by cooling you off, but it's using all its resources to do so. Treatment is to place the individual in a cool place so the body doesn't have to overwork anymore. Fluid and salt replacement is super important for the dehydration, and then you need to transport the individual to the hospital. On the other hand, with heat stroke, this is actually more serious than heat exhaustion. This is when the body temperature regulation fails. The body's not doing what it's supposed to do to help cool you off. This is when your temperature gets above 105 degrees Fahrenheit. The skin appears red and hot, but there's no sweating that's taking place. Again, they'll develop nausea and weakness, but they'll start to also have mental confusion, loss of consciousness, and they could start seizing and have convulsions. Without quick and rapid treatment, brain damage can occur and death could also result. How do we treat heat stroke? Well, rapid cooling with cold water is important, and immediate transport to a hospital needs to take place. Another type of thermal injury are burns. Burns can be caused by fire, steam, hot liquids, chemical, and electricity. Burns get classified by the depth of skin injury. So guys, especially when we're talking about if you were on fire or that sort of thing, you need to be really careful to make sure that the fire gets put out by using that whole idea of stop, drop, and roll. With steam or hot liquids, you have to be careful because they can continue to, especially the liquid, if it stays on you, as well as chemicals. The main complications with a burn are fluid loss because you've taken out that layer of skin, as well as infection. Treatment. It depends on the degree of the burn and the type of the burn. You're going to treat a kind of fire burn different than an electrical burn. Also, the location makes a big difference. Cooling of tissue with cold water to prevent further burning may need to be done. Analgesics, which are painkillers, antibiotics to prevent secondary infection, and surgical debridement may need to be done to take care of and get rid of any of the burnt and damaged tissue. Now, there are different types of burns. We have first degree burns. This is fairly common. They are painful. They have redness and swelling of the skin. But guys, a first degree burn mostly just involves your epidermis. This is what we would look at if you had a pretty bad sunburn. It heals within a couple of weeks, but it may have some peeling that might take place. Second degree burns are also called partial thickness burns. These involve the epidermis and the dermis. These tend to also be very painful, even more so than a first degree burn. They'll have redness, but the main thing that distinguishes them from a first degree burn is the presence of blisters. If a blister is present, even if you call them water blisters after a really bad sunburn, that's a second degree burn. When these blisters rupture, we then have open wounds. This usually is going to take longer to heal, for about 2 to 3 weeks. Infection can be a big issue, and if an infection sets in, it could progress this into a third degree burn. Third degree burns are also called full thickness burns. They involve the epidermis, dermis, and exposing layers of fat, muscle, and bone, like you can see here. The burn areas are painless because the nerves have been destroyed in this. Characterized by charred and broken tissue layers. Treatment is often going to include skin grafting because we took so much of the skin out in this. It needs to be replaced with a skin graft. Scarring and deformity are very common in third degree burns. Now, those are all what we consider types of hyperthermia, kind of in a sense. So let's talk a little bit about hypothermia. This is when the body's core temperature falls below 95 degrees Fahrenheit. Symptoms are going to be extreme shivering, mental confusion. You'll start to have blue or cyanotic extremities because the blood's being pulled away from like your fingers, your toes, your nose, your ears. So those areas will start to turn blue, and you'll have a very weak pulse. Treatment, we need to remove wet clothing. A lot of times hypothermia happens because they fell into like really cold water and it's really cold outside. We need to remove the wet clothing. We need to warm the body with warming blankets, have the patient potentially drink warm liquids as well so we can warm them from the inside, and then immediately transport them to a hospital. If hypothermia starts to get extreme, especially on the extremities, we see that there can be frostbite. This is the freezing of the tissue itself. It usually happens on the face, fingers, toes, and ears. The affected area is painless and white, and this is due to the nerves being killed. Warming the skin leads to pain and redness, though. Treatment, rapid warming and warm water baths, and emergency treatment at a medical facility is required for frostbite. All right, let's talk a little bit about an electrical injury, like an electrical burn. Electrical injuries are when you have unprotected or inadequate insulated electrical wiring. And it could also, maybe you came in contact with lightning. When electricity enters your body, you're going to see damage at the point of entry and the point of exit. Common cause of death is from respiratory and cardiac arrest, especially with the heart because your heart runs on electrical signals and electricity just surged through your body. So we do see that respiratory and cardiac arrest are the most common cause of death with an electrical injury. Radiation injuries are due to ionizing radiation like X-rays or even sunlight. The cause is exposure to sunlight or tanning beds. Prolonged exposure to sun or tanning beds cause the skin to become prematurely dry, brittle, and wrinkled. They start to lose their elasticity. Causes the skin to appear much older than its natural age. Now, when we look at this too, remember that especially with radiation injury like sunlight and X-rays, if you're exposed quite often at the skin level to this radiation, that could develop into types of cancer. We also have pressure injuries. Pressure injuries are going to definitely take place in areas where tissue is kind of between two hard parts where there's not a whole lot of cushion. So you would see this like on your heels, your tailbone, your hip bones if you're laying on your side, maybe your elbows, areas like that. It's commonly called bed sores or pressure ulcers. These are called debunculous or pressure ulcers. They affect bony areas like the heels, sacrum, and elbows. Increased pressure on these bony areas slows down blood flow. This leads to ischemia. Remember, ischemia is decreased blood flow, which means also decreased oxygen to the tissue, which ultimately leads to necrosis. Prevention, frequent turning and repositioning of the patient is key. If the patient is not able to turn themselves, you have to do it for them on a very regular basis, making sure that these hard parts are not having the pressure all the time. Also, when we look at this, massaging the affected area to improve circulation can also be beneficial. Now, if bed sores continue to get worse and worse, wound care will have to take place to try to heal these up. But guys, they can get really bad really quick. We also see corns and calluses can happen. This is a protective hyperplasia of the tissue where the tissue grows thicker in the area to help protect against the pressure or the damage. The main difference in a corn and a callus is its location. So corns are found on your feet. They're often painful due to ill-fitting shoes as when they occur. They can be surgically removed. Calluses, on the other hand, are not usually painful. They are most commonly going to take place on your hands, and they protect the hands from repeated injury from occurring. All right, staying in there with trauma, let's talk a little bit about insect bites and stings. Insect bites and stings are going to vary depending on what kind of insect we're looking at, but they can vary from blood-sucking mosquitoes to ticks, flies, fleas, bed bugs, to also things that sting like hornets, bees, stuff like that. They may cause swelling and itching at the site of the bite or the sting. Insect bites can also transmit other diseases like malaria. We also saw with earlier Lyme disease, things like that. Symptoms. Depends on what the bite or sting consists of. If venom or poison is present, it may cause an allergic reaction. These can range from mild to severe, but severe reactions could send the patient into what we call anaphylaxis or anaphylactic shock. Treatment, hydrocortisone cream is very helpful. Antihistamines, analgesics, or painkillers. Emergency medical treatment might need to be done if they go into anaphylactic shock, which requires maybe the use of CPR and definitely calling 911 to get that patient to a hospital. So let's talk about a few types of these. Let's talk first about some spider bites. Black widows. Black widows are the most commonly known poisonous spider. Only the female is the one that bites though, and it's usually when they're disturbed or trying to protect their eggs is when they bite. Now, their webs are also very distinctive. You should be able to tell they just look like a mess. They're not those really pretty kind of spider webs that you would see. They just look like a mass of web, and they do like metal and wood areas. The cause of this bite is the venom from the spider is a protein. That protein affects the victim's nervous system. These symptoms include acute pain at the site. They can progress to abdominal pain, nausea, fainting, and dizziness. Treatment is normally a cold compress and a pain reliever. Another type of spider bite is a brown recluse spider. These guys are very dangerous. They're also called fiddleback or violin spiders due to the shape of what looks like a violin on the back, and so sometimes they're also called the brown fiddler. These are very reclusive. They live kind of by themselves, but they bite only when threatened. If they feel like something's coming in and threatening them, they will attack you. Okay, so they can get pretty aggressive. The cause of the issue whenever they bite you is the venom is extremely poisonous. But bites are rarely fatal, but deaths have been reported when people don't go get treatment. So you can see kind of a progression here where we see that the bite has taken place and they have some issues that are happening, but underneath the skin, more is happening than what you see on the surface. Venom can actually eat away at the tissue underneath the epidermis and can cause huge craters under the skin. So treatment, application of an ice pack, analgesic medication, but you need to seek medical treatment to make sure that it doesn't cause a huge crater where wound care has to happen on a daily basis. All right, so last couple of things here. Let's talk about some rare diseases and then let's talk about aging. When we look at some rare diseases, you can see that one is called elephantitis. This is hypertrophy of skin and subcutaneous tissue, giving an elephant-like appearance. This happens a lot of times due to lymphatic vessels being clogged. The lymphatic vessels get clogged specifically with a type of worm called a filarial worm, and it causes a stretching of the skin to take place. This inflammation of the lymphatic system results in this fluid accumulation. So again, the common cause here is something like a parasitic worm, most common in tropical areas such as Central Africa. A lot of times it can happen in the leg, but it can happen pretty much anywhere. If you want to Google elephantitis, you can get all kinds of disturbing pictures of where it can occur. We also see that this could be spread by mosquitoes and blood-sucking flies as well. All right, what happens to our skin as we age? Well, our skin does start to thin as we age, especially the epidermal layer. It retains less water, which leads to easy tearing and dryness. So this is why some people, once they get older, if they hit their hand like on a desk or the door or something, they just bleed like a stuck pig because the skin breaks. We also see xerosis happens where sweat and sebaceous glands do not function as well. So this causes the skin to get very dry. Skin lesions become more common because we've had years and years of exposure to things. Seborrheic dermatitis, rosacea, and psoriasis are frequently seen disorders in the elderly. Thickening of the nails starts to occur. Thickening and increased brittleness of their hair. Loss and graying of the hair happens, and then of course different types of skin lesions start to develop over time, especially due to, again, those exposures. If they're 80 years old, they've been exposed to some different things for 80 years versus somebody who's only 20 years old. All right, so there's lots of different effects of aging. Also, they start to lose a lot of that hypodermis layer, the fat layer, and this causes them to get cold easier, but also their medications react differently. So we've really got to watch dosages as people age on their medications. All right, so if you have any questions, please feel free to ask.